Interpreter access remains an ongoing issue in many hospitals throughout Australia. To this day, many in the deaf community face challenges with access in the hospital setting, especially for those who use Auslan as a primary form of communication. This video will introduce you to issues surrounding interpreter access and how you can make a difference. The Australian Charter of Healthcare Rights include the right to access healthcare, the right to be informed with clear and open communication, and the right to participate in choices about healthcare. Auslan is a sign language for the Australian deaf community, which means these processes rely on Auslan interpreters. Government policies including the Department of Health Language Services policy and the Cultural Responsiveness Framework in Victoria outline that the optimal healthcare practice for deaf people must involve qualified Auslan interpreter services at critical points in patient care. Auslan interpreters in the hospital are essential for proper access to services, and yet many in the community have found it difficult to get an interpreter. The reduced access to Auslan interpreters in hospitals has yet to satisfy the demand in the community. The most relevant and up-to-date data gathered in 2004 identified that for every 1,000 deaf consumers in the metropolitan areas of Victoria, only 46 would have access to an Auslan interpreter. 87% of those who attended a medical consultation required an interpreter, but only 66% of those requests were met. 10 years later, 31.9% of these requests were still refused. This causes communication breakdown, which can lead to poor health outcomes, violating patients' rights, and denying patients true informed consent. The reality is that by not providing interpreters, it can have a detrimental effect on a patient's welfare by potentially increasing the risk of complications. It can even place further burden on the healthcare systems by reducing efficiency and increasing length of stay. One example of the integral role of Auslan interpreters in the hospital is portrayed in this short clip. There are multiple contributing factors to poor interpreter access. Currently, there's a low number of highly qualified interpreters with experience in the medical setting. This is worsened with funding limitations of organizations to train or provide interpreters. There is also difficulty accessing interpreters after hours, in rural settings, or in emergency situations. Some healthcare workers are even unaware the deaf community have the right to access interpreters, while others may not be familiar with the interpreter booking procedures of that hospital. On top of all these factors, Auslan interpreting is physically demanding and can cause overuse injuries, which limits their work capacity. Imagine if you were in a foreign country where you didn't speak the language and you had a medical emergency in the hospital. If you were alone and there was no one to help you translate, what would you do, and how would you feel? The deaf community are well aware of this issue and are passionate advocates for change. They already utilize friends and family to interpret, pay for private interpreters, or use written communication. However, this is not always effective and ignores the responsibility of the healthcare system to provide equitable care. So by being aware of this issue and the rights of the deaf community, we can become better informed healthcare professionals. It is your responsibility to promote change and advocate for interpreter bookings in the hospital when appropriate. It is important for you as healthcare practitioners to identify these situations and take action to provide the best possible care. Each hospital has its own protocol for booking interpreter services. Be proactive and learn these procedures during your placement or clinical workplace. Additionally, there are several Auslan interpreter services available, such as Sign Language Communications Victoria, Video Relay Interpreting, NABs, and emergency and after-hour interpreting. Making a positive impact on a deaf person's experience of healthcare is an important step towards an equitable healthcare system. And remember, you can make a difference. VicDeaf is the primary source of reference, referral, advice, and support for the deaf and hard of hearing community in Victoria. For more information on VicDeaf and its interpreting services, head to www.vicdeaf.com.au.